Bismillahirrahmanirrahim. Today we are going to start the brain toward the coming to the brain because we have covered the spinal cord. So you know that there are three parts of our the brain: the forebrain, midbrain, and hindbrain. Forebrain may contain your cerebrum majorly, and then the diencephalon part in which is epithalamus, subthalamus, hypothalamus. So these things you discuss in the diencephalon. We are starting from lower to upper. Spinal cord had been covered, so coming to the brainstem. So actually our discussion will first, as in the spinal cord, we have covered first the external feature, then come to the internal feature and discuss the tract. So you know that here is the cerebrum part. So this part is diencephalon, which contains thalamus, epithalamus, subthalamus, and here is your brainstem part. So upper part is the midbrain, then the pons, this part, and lower is the medulla. So after the crossing the foramen magnum, this is continuous with the spinal cord. So all the as you know, but for the spinal nerve, their nuclei for the lower motor neuron was present in the interior horn, while the nucleus for the your cranial nerve is present in the your brainstem. So we have 12 pairs of cranial nerve and 31 pairs of your spinal nerve. So these 12 pairs, so out of these 12, 10 are present just in the brainstem level. Okay, so 2 are on the upper margin, so a lower 10 mean from 3rd to 12. So they are present in the cranial nerve. So if I use some word for brainstem, because especially in case of injury, if you damage the brainstem, mean you are damaging the cranial nerves nucleus. So you are not because because vagus nerve, for example, supplying your abdominal part, your heart, and the thoracic part. So if you damage these nucleus, mean you are losing the respiratory pathway, disturbing the respiratory pathway, cardiovascular pathway. Different pathway are going to be damaged. So eventually what will happen in the complete damage of brainstem is the death, no other way. So it's really important, especially for life. So if you damage other area, maybe your senses loss or motor supply loss, but if you damage the brainstem, you are going to lose the life. Okay. So all the tract for spinal cord, ascending cross, upward going to cerebrum, descending go down, cross the brainstem. So all the tract also cross the brainstem. So and the nucleus for the cranial nerve present here. So it's really important. So starting from just reminding you the spinal cord because it's little bit continuation of that. So you know better sensory pathway are located posteriorly, and the motor pathway, the red one, so they are mostly present in the interior horn. So for you, important thing, your pyramidal tract, the lateral corticospinal and your interior. So these are the pyramidal pathways. So lateral crosses at here. So you will see the pyramidal tract in the interior part, while the sensory pathways, for example, the fasciculus, cuneatus, gracilis, cuneatus for your upper limb and the gracilis for the lower limb. So you will see when you look at the brainstem, so you will see the interiorly pyramidal tract will be present, while if you look posteriorly, your sensory or you can say gracilis, cuneatus tract will be present because they all are crossing the brainstem. So you will see these things. So and so come to the your external features. So I'm not going to, because you can see the nucleus of are present interiorly, while the motor are interiorly majorly present and sensory are here. So coming to the interior view, mean in the front, when you see in front what is present majorly, because interiorly what is crossing pyramidal tract. So first starting from the lower is the medulla, then pons, then midbrain. So first we are looking at the medulla, then looking at the pons, then come to the midbrain. So in the medulla, so first thing you will see the interiorly is these are what pyramidal tract. So and these are your olives actually. So these are pyramidal and pyramidal are present here. These are the olive part. So you will see the crossing at here. So like this. So because they are descending tract. So they are coming like this. Other will cross this. So they will cross. So you will see crossing in the medulla level. So this is pyramidal, and you will see the olive on the lateral. So these are the olive. So because they are associated with majorly the olivary part. So when you see the section of medulla, you will see the inferior olivary part. So these are here. You can see. And so this part, which is central is the interior median sulcus. Interior median sulcus. So this is the interior median. This will be the posterior median. This is the interior median, and this is the interior lateral. So and you will see the other. So this is your interior lateral. One is the median, other is the lateral one. So here you will see in this sulcus, interior lateral, the nerves is common. That is your 12th cranial. So your lower four, 9th, 10th, 11th and 12th are present in the medulla level. Okay. So this is your 12th one. That is your hypoglossal nerves. So and here is something that is your inferior cerebropeduncle, which are connected with your cerebellum. So these are what inferior cerebellar peduncle. So you can see here is cerebellum, because in front is your the brainstem is present, which is associated with your cerebellum. So your midbrain is connected with the cerebellum by the superior peduncle, and pons is connected with the medial cerebellar peduncle, and your medulla is connected by the inferior cerebellar peduncle. So the fibers are going transverse fiber go into the medulla transverse, and the pons and your the midbrain. So they are going into the cerebellum, because the posterior is present the cerebellum. So and you will see another sulcus here. So that these are the interior one, median and lateral. So this is the posterior lateral sulcus. So here you will see three nerves coming out. So 9th, 10th and 11th. So 9th, 10th, same thing, because they are pair on the both sides. So this is 9th, that is the glass of rain. 10th is what? Vagus. 10th is vagus, and your 11th is the subspinal accessory, which is supplying your sternocleidomastoid and trapezoid muscle. So and vagus is majorly your controlling the thoracic part, abdominal part, and the larynx and pharynx muscle. So they are majorly controlled by the and hypoglossal. So if you look at the tongue, interior 2/3 is by the facial nerve, and the posterior 1/3 is by the hypoglossal, and the root of the tongue is supplied by vagus. Interior is facial. Facial not supply is not taking the sensation from your face. Here is the trigeminal, which controlling the ophthalmic and the maxillary mandibular plan. So interior 2/3 is by the facial, posterior 1/3 by the hypoglossal, and the root of tongue is supplied by the vagus. Because vagus is also going to the larynx and pharynx, so they supply the root of tongue. Okay. So these are four nerves which are present right here. So here is something that the foramen and cecum is just present right here, so don't worry. So this part, this is now coming to so this is midbrain. So this is the pons. Pons actually is like your bridge type. So they are going into the connecting the the left and the right hemisphere of the cerebellum. So they are like a bridge between the left and right cerebellar hemisphere. So there are actually transverse fiber are going over. So because when there is bridge, so traffic continues. So the traffic which is crossing is so this part which connecting the pons with the cerebellum is the what? Middle cerebral peduncle. Pons is by the middle. So you will see these fibers are going So they enter through the middle cerebellum, enter into the cerebellum. So these are your pontine fiber, median pontine sulcus. So these are pontine fiber. So here is sulcus where when you see the blood supply, your basal artery, this depression, sulcus, which you see like this. So here your basilar artery is going, which is coming from vertebra. When you see the blood supply, basilar artery move right here. So now look at the nerve supply. We have covered the 9th, 10th, 11th and 12th. So move upward, mean we are coming to 6th, 7th and 8th. So you will see the 6th, 7th and 8th. So this is your 6th one and here is your 7th. So just look at it. So they are present at the junction of your pons and the medulla. So most medial is the your abducens nerve, that is the 6th nerve, and this is the facial nerve, because facial is the mixed type, so sensory and motor. So you will see both things. And vestibulocochlear, that is going to the nerve. So if you look at the abducens, they are supplying the eye muscle lateral movement, abduction of the eye. So when the extraocular lateral rectus is supplied by the abducens. So if you look at the facial, they are majorly they are actually supplying the interior tooth hold of the tongue, and the sensation actually taken from the sensation from interior tooth hold. But the trigeminal is the major nerve which take the sensation from your face. So if you look at the other thing, so here is your the 6th, 7th and 8th are covered. So this is the trigeminal, that is the 5th nerve. So sensory part and the motor part. So they are also mixed type. So because ophthalmic eye areas and your maxillary areas and the mandibular area. So your ophthalmic and the maxillary, these are purely sensory, but your mandibular has the motor component which is supplying the mastication muscle, temporalis and the pterygoid muscle, so median and lateral. So their mastication muscle are supplied by. So they have sensory component and the motor component. So because only the third branch, that is mandibular, have the sensory motor part. So they are smaller one. So bigger one is your sensory. Okay. So come to the midbrain. So these are actually because these are connected by the cerebellum as well by the your cerebrum. So these are these were the cerebellar peduncle. Now we are going to see the cerebellar, cerebrum related. So these are your fiber which connecting you with the cerebellum. So these are cerebellar peduncle. These were the bellar and beryl. So they are connected with your cerebrum. So here is your actually the optic nerve is present. So this is not associated with your brainstem. It is on the upper part. So here is the tract, and here is you will see both are connecting here. So chiasma formation occur here. So this is optic chiasma, and here is your optic nerve. So that is second cranial nerve. So this is your cerebellar peduncle, and this depression you are going to see here is the fossa depression. We named use fossa. So this is interpeduncular fossa between the two peduncles. So here actually you see the nerves is coming out. So we have reaches at the 5th, 6th, 7th, 8th are covered. So from we are going to see the 4th and the 3rd one, because first two are above the midbrain. So this is the oculometer third, and this is the trochlear one, which is the 4th cranial nerve. So the oculomotor majorly supply the eye muscle, as well as the motor component they are supplying also the parasympathetic, because they are also mixed type of nerve. So if you look at all the muscle of eye, extraocular muscle are supplied by the oculometer except two. One is the superior oblique, that is supplied by the trochlear nerve, and the other is the lateral rectus, that is supplied by the abducens one. Okay. So your parasympathetic supply for example eye for accommodation. What does mean by accommodation?
small or
constriction or the
extension.
extension. So for example, when you see far away, your eyes straighten. So this is accommodation, means your is straighten. But when you see closer, so they become convex, so convex like, so like this. So you will see when you see closer, your eyes are, for example, if easier way, just look at the nose, you will see your eyes are constricted. So this is accommodation. Okay, for wider, so because lens becomes straight when you see far away. When you look closer, your eye becomes shortened or your constriction occur. Okay, so this is the oculomotor, trochlear and trigeminal. So and here you, because the for endocrine, you know better, optic chiasm associated with your the pituitary. So here you will see the stalk or infundibulum of the inferior. So here is your tuberous cinerarium and this is your pituitary gland actually. So here is actual. So here are something other present, that are your memory body. So two memory bodies are present in the midbrain. So and something other is present, that is the posterior perforated substance. So what you have seen, because don't worry about the nerve. So I'm just showing the trick which will be easier to identify the nerve. So just look at the picture. In the middle, you will see the medial is the pyramid, and then the comes what, olive, and then laterally come peduncle. So the interior median sulcus, interior lateral sulcus, and the posterior. So last two sulcus, the interior lateral associated with the 12th, and the interior posterior lateral is associated with your 9th, 10th, and the 11th. So this is about the, and your cerebral connecting with the cerebellum. Inferior is connected. So if you look at the hair pons, which is the bridge between the two hemispheres, so you will see the your 6th, 7th, and 8th are coming here. So and the 5th one, the trigeminal, is present here. So major part is the sensory and smaller is the motor. And so this is the middle cerebral peduncle which connect with the cerebellum. So if you look at the midbrain, what you are going to see? Cerebral peduncle, and over this the optic chiasm and your memory bodies are present here. Okay, so nerves are the oculomotor and the trochlear. So easier way to remember, if you when you reach at your room, so just practice, draw these arrows. One is like this in slow way, other draw horizontally, and two arrows. One is like this, other is the smaller one. So one like this, other like this. The fourth arrow, when you draw fourth arrow, you can easily identify the nerve location. So starting from our first arrow. So here this show the third, fourth, and fifth nerve. So you will see the third is oculomotor is here, fourth is here, fifth is here. So third, fourth, and fifth. So because we are coming from the midbrain, so when you draw like this, so because when you see the picture which is not labeled, you have to label. So easier way, third, fourth, and fifth. Okay. So fourth and fifth are much more closer, you can see. So if you look at this, so draw like this. So sixth, seventh, and eighth. So this is more medial is the sixth one, abducent, and the seventh is what? Facial, and eighth is your vestibulocochlear. That is so with the your the hearing and the balance. So one part is the vestibular, other is cochlear. So one is with the hearing, other is with the balance. So come to this arrow, that is should be from the 8th as we covered. So 9th and 10th, 11th. So 9th is your glossopharyngeal, and the 10th is vagus, and the 11th is spinal accessory. And this arrow is smaller one, that is your 12th one, that is your hypoglossal nerve. So easier, so 3rd and 4th, 5th are in the midbrain, and the 6th, 7th, 8th at the junction of the pons and medulla, and 9th, 10th, 11th laterally, posterior-laterally are present. The 9th, 10th, 11th, and the 12th are present medially. So practice when you just one time practice easier way, so you never forget. Okay. So I think interview is clear. So midbrain you know better. The nerve 3, 4, 5 and the 6th, 7th in the junction, and the 8th, 9th, 10th, 11th laterally, and the hypogloss medially. So and here you see the optic nerve which is above the midbrain, not associated, and your memory body. So these are memory body. Actually, this whole part is associated with your hypothalamus. So nucleus of the hypothalamus are present just in the interpeduncral fossa. So we are coming to the lateral view. So lateral view means we are seeing just laterally. So for example, interior view we have seen. So now coming to the laterally. Laterally almost same thing, but half of the side you will see. So just look at the lateral view. So same pattern with the nerves. So here you are the pyramids, and your only part you are seeing only part is here. So this laterally was the medial was the hypoglossal, the lateral was the 9th and 10th, 11th. So just see, so these are 3 nerves. So this is your the 9th, and this is your 10th one, vagus nerve, and this is your 11th, that is spinal. We call them spinal because you will see they are just reaching at the medulla and the spinal cord junction. So just coming from actually spinal, because they are supplying your the trapezius and the your sternocleidomastoid 2 muscle. So they are actually supplying this coming down down into the foramina and supply these 2 muscles. And vagus, you know better, the pharynx and larynx, and the glossopharyngeal is supplying your the tongue muscle. So tongue muscle, and you are seeing. So here is your hypoglossal. So the medial one. So olivary. So if you see here, this is the pons part, and the peduncles are right here. So this nerve medial lateral. So 6th, 7th, and the 8th cranial nerves are present. So 6th is the abducent, and the 7th is what? Facial. 8th is what? Vestibulocochlear. So this is your vestibulocochlear. So come to the pons. So this is geniculate body. So the 3rd and 4th and 5th are present. So 4th, 5th. So this is third is what? Oculomotor, and the 4th is trochlear, and the 5th is trigeminal. So these are the 3rd, 4th are. And here you will see the optic nerve, optic nerve. So this is nerve coming here, other is coming here. So this is optic tract, and here is scalp, and here is your optic nerve, which is going to supply the ear. So in that part you have seen 3rd, 4th, 5th are like this. When you see laterally, so 5th you will look like they are coming medial part. So 3rd, 4th, in the last picture we have seen the 3rd, 4th, 5th. When you see laterally, so 5th you will see they are medial. So because the nerve the identification is important. The other thing which is really tested for any lab manager or your professor or any exam, they ask all the nerves coming interiorly. Only the one nerve, that is the trochlear one, 4th one. So that is present posteriorly. So when you see the posterior vision, you will see the only trochlear. When you see interior vision or the lateral vision view of the brainstem, you will see all the nerve. So but trochlear is coming posteriorly. Okay, so keep this point.
Trochlear nerve cannot be seen from anterior view.
Is present, but they go back and cross and then go to your eye. So there, for example, a brainstem is here. So they all the nerve come interiorly, but this nerve go posteriorly and cross and supply the superior only. So and the 6th is abduction, will supply the lateral rectal. So come to the posterior view. I think the posterior view is much more important, because this if you look at the brainstem connection with the ventricle, which ventricle is associated with the brainstem and cerebellum? Fourth ventricle. So actually in the ventricle discussion, 2 things are majorly problem for the student. One is their pathway. When you see animation, it's easier. Other thing is the the floor of the fourth ventricle, the major question which can be asked in MCQs, SAQs, or any type of question. So when you see because the brainstem therefore is interior to the your fourth ventricle, because cerebellum is here and the brainstem is here. In between there is the fourth ventricle. So you will see the when you see the posterior view, you are also seeing the floor of fourth ventricle. So 2 in 1. You can see this posterior view is 2 in 1. You are also covering the floor of fourth ventricle, also covering the posterior view of brainstem. So nerve, which nerve we will see? The only trochlear nerve, fourth one. Okay. So coming from the midbrain. So you know whether when you see the interior view, we see the pyramid was moving interiorly. Posterior was the sensory pathway. So means your the cunate and your gracile tract are moving. So just see from the medial thing. So medial is gracile or the cunate? Gracile, and the cunate is upper limb is the lateral aspect. So this here because when I discussed in the spinal cord, the ascending tract, I mentioned their nuclei was present in the medulla. All other was present in the interior horn. So when we discuss the dorsal column, so their nuclei were present in the medulla. We just see both. So here is your gracile tract, and here is gracile tubercle, where you will see the nucleus of the gracile. So laterally, so this is your actually sulcus, which is posterior median sulcus, because the posterior view. So here is the cunate tract, and here is the tubercle of the cunate. So these are what the peduncle. Which one? In the medulla.
In the medulla, median.
Inferior cerebropeduncle, and pons in the middle cerebropeduncle, connected by the cerebellum, and the superior cerebellum with the midbrain and cerebellum. So keep this basic concept. So this is your inferior cerebropeduncle. So this is your fourth ventricle. So we are actually seeing the fourth. So from now to up till the discussion of midbrain, everything I'm discussing you need to mention in the discussion of floor of ventricle. So because you can see there some part is associated with the medulla and some is associated with the pons level. So this is your actually the median eminence, and this is sulcus, median sulcus, and these are actually limit of this sulcus. We call them sulcus limitant. So these are your sulcus limitant. Okay. So we are dividing so this lower part is associated with the medulla, the upper is with the pons. So here actually you see the triangle, which are really important. So we are actually when you discuss the interior view, we are seeing which nerve are present in the medulla. 9th, 10th, 11th. 9th was glossopharyngeal, 10th was vagus, 11th was spinal accessory, and 12th was the hypoglossal. So we are actually seeing the triangle. They are associated with these. So first we are seeing the hypoglossal triangle. Other is the vagal. Vagal actually associated with the all three, the 9th, 10th, and the 11th the nerves. Okay. So we are looking to hypoglossal was the medially, and the vagus the 9th, 10th was present laterally. So we also see the triangle are laterally for the vagal. So just see here. So this is actually medullary structure or fiber which divide this part, pons and the medulla. Just see what is happening. So this is first triangle which is medially. So this is for the hypoglossal trigone. And other triangle you are seeing, this one is your vagal triangle. Okay. So this is associated with your 9th, 10th, and 11th, and the hypoglossal associated with your 12th one. Okay. So actually this is the sulcus limitant. So if you it's not important, but if you see, you will see the depression right here. So you can, if you are able to see, you are seeing depression in the lower margin. So one is here, one is, so we actually call them fovea. In the inferior fovea, other you will see in the pons, that is the superior fovea. So other thing, if you see, they are like a cone. If you see the inferior buttock, they are like a cone or pen nib. So they are forming two sides or angle formation. So senior faculty actually ask this, what is this? So just see, the sides are actually, you are seeing this side of the inferior angle. So these sides are actually tenia. So two tenia meet and form the obex. So this part where they are meeting, that is the obex. You can say inferior angle is the obex, and the inferior lateral sides or margin are the tenial. So these are actually terms not much discussed in the high level, but in the lower level they may ask this, what is the obex? Okay, so this is should be the medulla. So they are actually pin nib like. So this in we also use word for this is the calamus scriptoria script writing. So their pen nib means simple. So these are actually the word. So now coming to this is medulla covered. So the medial is the gracile tubercle, gracile tract and the upper and the tubercle, cunate tract and the cunate tubercle, inferior cerebral peduncle. If you look at the ventricle medullary part, we have seen two triangles. One is the medial one, that was the hypoglossal trigone, and the other was the vagus trigone. And we have seen on the sulcus limited two depression. One was the inferior fovea, and we have seen the sides. Sides were the tenia, and the angle was the obex, where two tenia are meeting. Okay. So come to the pons. So pons, you know better in the junction of pons and medulla, your sixth, seventh, and the eighth was sixth was the abducent, and the seventh was the facial, and your eighth is the vestibular corridor. So this area is actually associated with your vestibular part. So one part is the inferior which is associated with the medulla, other is the superior part. So this is what part of your peduncle. This is what which is with the pons is the middle cerebral, because this is the inferior cerebral, this is the middle cerebral peduncle. So this is the lower vestibular area, and this is your superior, associated with your vestibular part. So if you look at the other thing in the posterior view, one is I have seen the nerve, the other you are seeing the facial colliculus. The term is facial colliculus. So actually the nerve, the sixth, because we have seen the medial one was the abduction. The actually nerve of the facial, when they come, they go move posteriorly like this, like a curve around the abducent, and form a depression, you can say on the fourth ventricle, because posterior is fourth ventricle. So when they move and form a depression, so this depression formed by the facial nerve is the facial colliculus, because they move like this, trigone. When you see in the internal structure, so you will easier. Just for this, you will see here like this depression. So this is actually associated with the facial colliculus. Okay. So and as you see in the inferior fovea was in the medulla, superior fovea you are going to see here. So this is your superior fovea actually. Okay. So other thing which is not important with the physiology, the anatomy part, but is associated with the physiology, that is actually the locus ceruleus. So this is actually colored part. Colored means there should be a melanin. So the nerve cells which are present, they have a melanin pigment. So important thing is that they have actually the norepinephrine. So there is the norepinephrine, large quantity of norepinephrine are present here. So this is actually asked in the physiology especially. So substantia nigra present, they are colored pigment because melanin is present, and the norepinephrine you will see in this area. So coming to the other thing. So here is actually your frenulum valley, this part, the upper. But important thing is the nerve. Nerve is just coming from here. So this is your which nerve? Which is ask the which is only nerve which you will
Trochlear,
see.
trochlear.
Trochlear. So this is your trochlear nerve. Okay. So trochlear nerve, most important. So the fourth trochlear nerve. So now coming, this part is covered, I think. So we have seen what we have seen, the vestibular area, upper and the lower, and we have seen the facial collicular. Because when you see the actual the world, practical life, so you are not seeing the all the things now are coming or not. So when you see the picture or the MRI or anything, the X-ray, you are actually there are some identification point. One is you can see the facial colliculus is the major one part. You are seeing on the floor of the fourth ventricle. So and the nerves. So now, so in facial colliculus and the superior fovea, locus coeruleus, and the fourth trochlear nerve are present. So come to the here. This is your the other peduncle. Which one? Which is the midbrain. Inferior middle has been covered. Superior cerebral peduncle. So this is actually your superior cerebral peduncle. Okay. So the here is actually cerebrum. So what you are going to see, these are actually your cerebral peduncle, which are connecting your brainstem with the cerebrum. So this is your actually cerebral peduncle, cross cerebri of the cerebral peduncle. So another thing you will see also, because this part is associated with the hypothalamus, so you will see also here pineal body. Okay. So the major important thing you will see in the world of the midbrain are the superior colliculus and the superior colliculus and the inferior colliculus. Fourth thing, two superior, two are the inferior. You can see here. So this is your superior colliculus, and the other one are the inferior colliculus. Okay. So they are actually, which one is associated with your vision and which is auditory? Superior is with the vision, and the inferior, because I use the trick. When you see the superior eye is your superiorly present as compared to air. So superior colliculus with the vision, and your inferior with the auditory pathway. So major question are asked in the exam. So they are actually associated with the tactile pathway, tactospinal pathway, where superior colliculus taking reflex from eye, associated with the eye reflex, and for the hearing or auditory is your inferior colliculus. So they are actually connected with the medial and the lateral geniculate body of thalamus. So this part is actually brachium, we call it, which connecting the superior colliculus is the superior brachium, and which connect the inferior colliculus is the inferior brachium. So three questions are actually three or four type of questions can be asked with the colliculus discussion. One is so which one is with the visual pathway? Superior colliculus, and which brachium? Superior brachium. You can see the connecting the superior brachium. And other is the geniculate body. Which geniculate body is the lateral one? Lateral superior. And so easier way for if I use a trick. I use a trick when you a junior salute the senior one. So they put like hand here, salute. So for salute you can see superior, and so the salute L represent the lateral. So superior colliculus and your superior brachium, and the L represent the lateral geniculate body. So all the three words are associated with your vision, and the other you can easier the inferior or the inferior colliculus, inferior brachium, and the medial geniculate body associated with your auditory pathway. So posterior vision, I think so. Fourth ventricle discussion is major important. So in the peduncle, in the medulla, we have seen the geniculate body, the gracile and the cunate, the tract, and the inferior peduncles. And when you see the fourth ventricle, what is mentioned? Trigone, two trigone. One is the hypoglossal, other is the vagal trigone. And if you look at the pons level, you have seen the facial colliculus. So these superior fovea, inferior fovea are not much important. Major importance is these things which can be tested actually and you see the lower vestibular area and the upper vestibular area, and the nerves is the trochlear one is coming out here. And in the midbrain we have seen the four collicular. So they are actually present in the tectum, because we have tectum part, tegmentum, and the basilar part. Basilar is actually the part which rests on your skull, is the basilar part, and the other part is the tegmentum, which come the interior back to the interior part. And the tectum is actually the part, this part is actually which is posterior to the ventricle, because here is fourth ventricle. So part which lying behind the, because if this is posterior view, so this is actually your superior colliculus inferior, they are behind your fourth ventriculum, present in the tectum. Just see here. So this is tectum, and on the interior what you are going to see, the ventricle. So then you see the interiorly tegmentum part, and then interiorly the basilar. So what is the on the back, posterior to interior you come tectum, then come the fourth ventricle, then come tegmentum part, then the basilar. Basilar rest on the skull. If you go back to interior to this middle part is the tegmentum, then your fourth ventricle come, then the most posterior part is the tectum, where in the tectum you will see actually superior colliculus and the inferior colliculus. They are most important, especially with the midbrain, because when you discuss the rugulosupinal red nucleus are present in the tegmentum part, while your colliculus, superior colliculus is present in the tectum part. So we just stopping here and continue the second.